My name is Katie Wee. I'm 33. That rhymes. I live in LA and I'm an actress. I also teach yoga and meditation on the side. And that's me. Yeah. So when I decided I was going to get a double mastectomy and breast reconstruction, I realized that there were two different doctors, one for the double mastectomy, one for the breast reconstruction. So I needed to find two surgeons that I liked independently, but also who would work together. I kept meeting with doctors, and I finally found mine, who, as soon as I sat down with her, she understood what I was talking about in terms of, yes, you're going to have a double mastectomy. We're going to have a surgeon that I work with over and over again who's incredible and meticulous. Make sure to get all of your breast tissue out. That is going to be a given. She's going to do a phenomenal job with that. But our job is to talk about how you want to look and feel post-surgery, and we will collaborate on that vision. So I felt like I was able to talk with her about how I wanted to, look and how I wanted my breasts to seem on my body. And we really collaborated on a vision, and I felt like she understood what I wanted and also had a woman's perspective. She didn't make me feel like I had to explain to her why it was important that I wanted them to look good. My mom was my support system through my surgery. She really showed up for me in a huge way. She came and took care of me, came with me to my surgery, administered all my medication when I couldn't remember what was what and what I was supposed to be taking. She emptied my drains. It just showed me that inner resilience, that inner strength that so often we don't have to be in touch with. So often it's easy to get through life just kind of on our normal resilience level, normal annoyances, normal frustrations. Having a double mastectomy and breast reconstruction all at once and then recovering from that really put me in touch with my own inner resilience. And I was so grateful to have my mom there, really taking care of me. My plastic surgeon said that I should try to move my arms as soon as possible, which I found interesting. I sort of thought like, wow, we just messed with so many of my chest muscles and everything. To start moving my arms right away is gonna feel really strange, but I did. I started moving them right away to start working on the range of motion. She told me not to push down or to use my arms. Like, don't pull on the refrigerator, don't push on the car door, don't push down on the bed to get yourself out of bed. And I totally understood why once I was in recovery. She also said to eat well, and I really took that seriously. I really wanted to nourish my body with healthy food, and as I was eating, I was trying to picture the food really helping heal me. She also said to just rest a lot, which for me is a huge departure from my normal life. I am super go, go, go. I often overschedule myself and take on too much and end up having like burnouts and then realizing I need to rest and then doing it all over again. So I focus just on healing and being good to my body.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue. tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. Autoimmune diseases, example lupus and scleroderma, a weakened immune system, example taking medications to decrease the body's immune response, planned chemotherapy or radiation therapy following breast implant placement, conditions or medications that interfere with wound healing and blood clotting, reduced blood supply to breast tissue, clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.